So picture this. You trust a healthcare provider with your most sensitive information. You're given a promise, right? That they'll keep it safe. But then, that promise is broken. And not with some big, loud alarm, but with this chilling silence. This is the story of a massive data breach. But the real story, the real failure, wasn't that the locks got picked. It was that the security cameras weren't even recording. 1.9 million. Let that sink in for a second. That's how many patients got a data breach notification from Anne Arundel Dermatology. Over 1.9 million people, their names, their addresses, their health info, suddenly at risk. And as big as that number is, believe it or not, the real story here is even more unsettling.
Because, and this is the crazy part, that's exactly what happened. This wasn't some clear-cut theft. It was a complete mystery. The investigators knew that intruders were inside the system, but they had absolutely no idea what, if anything, was actually taken. And that uncertainty? That is the real catastrophe we're going to dig into today.
Yeah, this whole incident is just a perfect and frankly scary case study in a critical cybersecurity failure we're calling the forensic blind spot. It's a situation that happens way more than you think, where the lack of evidence becomes the disaster itself.
Okay, so what does that actually mean? Well, it's like this. You know for a fact that your house was broken into. The door's busted open. But you can't tell if the thieves stole your laptop and your TV, or if they just kind of looked around and left. And in the world of data, if you can't prove what wasn't touched, you have to assume everything was compromised.
So how do you investigate a crime when the evidence is, well, missing? We're going to do it by following 3 key clues that really expose this blind spot: the timeline, the target, and of course, the total failure of the evidence itself.
All right, our first clue. And this one isn't so much about how the attackers got in, but something far more telling: how long they managed to stay. The amount of time they spent just hanging out inside the network, completely undetected, is a massive, massive red flag.
Just look at this gap. From Valentine's Day all the way to mid-May. That's, what, nearly 3 months? For a whole season, unauthorized actors had the keys to the kingdom, just wandering around the network, and nobody had a clue.
In the cybersecurity world, there's a name for this period. It's called dwell time. And a long dwell time, like the 90-day window we're seeing here, gives attackers a huge advantage. It's more than enough time to map out the network, escalate their privileges, and figure out exactly where the most valuable data is hiding.
And just to put this into perspective for you, regulations like GDPR require organizations to notify authorities within 72 hours of discovering a breach. Here, the discovery itself took 90 days. The countdown clock never even started because the alarm bells just weren't ringing. At all.
Okay, so this super long intrusion, it leads us to our second clue. Why? Why would anyone spend so much time and effort targeting a network of dermatology clinics? It's not a giant hospital system. It's not a bank. So what was the motive here?
Well, the answer is that specialized healthcare providers are increasingly seen by hackers as soft targets. They hold incredibly valuable data, protected health information, or PHI, but they often just don't have the same fortress-like cybersecurity budget as a bigger institution. And that weaker security posture, that's exactly what creates the perfect conditions for a forensic blind spot.
And, it's crucial to remember this wasn't just a technical problem. It was almost certainly a human one. The attack probably went after human behavior. Study after study shows that simple human error, clicking a bad link, using a weak password, falling for a phishing email, is still one of the main ways breaches happen. Attackers love to prey on our trust.
And now we get to the final clue, the one that really defines this entire incident. This is the absolute heart of the forensic blind spot, the total and complete failure of evidence. This one sentence, right here from the official report, it's the most damning part of this whole thing. They confirmed someone broke in, but because they weren't logging things in enough detail, they had no record of what the attackers actually did. It's like knowing a spy was in the library, but having no idea which books they opened.
And here's the catastrophic result of all that uncertainty. Because they couldn't prove what wasn't stolen, they were legally and ethically backed into a corner. They had to assume all of it was. So the number of records they could actually confirm were stolen? 0. The number they had to notify? Nearly 2 million. Their entire patient database.
So after all that, what do we learn from a catastrophe of pure uncertainty? How can other organizations avoid falling into the exact same forensic blind spot? Well, the takeaways are pretty direct, and they're urgent.
First up, granular logging. You have to go beyond just knowing who's logged into the network. You need to track every single file they touch. Without it, you are flying completely blind. Second, you've got to hunt for threats proactively. Don't just set up digital tripwires and wait for an alarm to go off. You have to actively search for weird stuff happening in your system to slash that dangerous dwell time. Third, know your risk profile. If you hold valuable data, you are a target, period. Doesn't matter how big you are. And finally, you have to plan for a crisis. A mass notification plan isn't an if, it's a when. As this case proves, you might have to get ready to tell everyone.
Ultimately, this whole case forces all of us to ask a really critical question about the services we trust with our most private information. Are their security systems actually designed to give clear, undeniable evidence of what happened, or are they just set up to detect a break-in and nothing more? Because in this day and age, not knowing, well, that's just as bad as knowing the worst.